For this nutrition and disease assignment, I chose hypertension. My family has a bit of history with this, so I thought it would be interesting to do research on it and see what can be done from a nutritional standpoint. Hypertension, otherwise known as high blood pressure, is a condition where blood gets pushed against artery walls at too high a rate. It can occur in 3 stages and rarely has symptoms. There are some exceptions, however, where shortness of breath, epistaxis, and cephalalgia can occur. If left untreated, it could lead to serious health issues such as heart disease, heart attacks, strokes, and heart failure. Hypertension relates to nutrition in a number of ways. For instance, consuming excessive amounts of sodium or alcohol can raise blood pressure. Similarly, excessive intake of energy, generally through consuming carbohydrates and eating overly processed foods, are also culprits of high blood pressure. This slide shows systolic and diastolic blood pressure ranges. It can be seen that less than 120 and less than 180 is normal, and that 120 to 129 and less than 80 is elevated. Anything over that and hypertension becomes an issue. Stage 1 begins at 130 to 139 or 80 to 89. Stage 2 begins at 140 or higher or 90 or higher. In hypertensive crisis, begins at higher than 180 or higher than 120 and requires immediate medical attention. When it comes to hypertension, there is no shortage of risk factors. Some of the more common risk factors include age, which for men is usually under 64, and women it is usually over 65. Gender, family, stress, and being overweight. Other risk factors to consider are excessive sodium or alcohol consumption, not getting enough exercise, underlying medical conditions, and not consuming enough potassium. Nutrition guidelines for hypertension are pretty straightforward. It is recommended to incorporate or follow aspects of the DASH diet, which limits sodium to 2,300 milligrams per day or less, and carbohydrates to 55% daily calories. As seen on the slides, it is also recommended to have 6 to 8 servings of grains per day, 4 to 5 servings of fruit per day, 4 to 5 servings of vegetables per day, 6 1-ounce servings or less of lean meats, 4 to 5 servings of nuts and seeds per week, as well as 2 to 3 servings of dairy per day. With hypertension, it is also important to limit the consumption of sugary foods and alcohol, as they can be factors that increase blood pressure. Healthy habits that can be incorporated into daily life to treat and prevent hypertension include eating healthful foods, maintaining a healthy weight, exercising for at least 30 minutes a day, limiting alcohol consumption, not smoking, and getting enough sleep each night. Healthful foods to consider eating with hypertension are salmon, broccoli, low-fat or Greek yogurt, almonds, whole grain bread, and oranges. Salmon contains healthy fats such as omega-3, protein, and potassium. Broccoli contains potassium, magnesium, and fiber. Low-fat or Greek yogurt contains vitamin D and calcium. Almonds contain protein, vitamin B2, and magnesium. Whole grain bread contains fiber and iron. Oranges contain vitamin C, fiber, and vitamin A. Those foods are beneficial for treating or dealing with hypertension because they can aid in lowering triglyceride levels, provide essential nutrients to the body, lower blood pressure, and support overall heart health. And those are the sources.